Thanks very much, Smita, and thanks to PATH and MSH and Global Health Council for having me here. It's a pleasure to be here, and this is really a very important topic that is one that the administration and Administrator Shaw wholly embrace. And I just, by way of background, I joined the administration a little over 2 months ago, and I was brought in to help launch the President's $63 billion Global Health Initiative, which I'm sure you're all quite familiar with. And I brought in with a specific focus of trying to bring the benefits of innovative finance, public-private partnerships, and innovation to global health programs government-wide. So this afternoon I'd like to spend a few minutes talking about public-private partnerships and how we are trying to turn the President's vision for partnerships into a reality for our development activities under GHI and specifically in maternal and child health. And through this I'll talk a little bit about the types of partnerships that we've formed and are continuing to form, and if I have time I'll get into some of the lessons learned. So President Obama has called the spirit of partnership a defining feature of our foreign policy, and we've heard this echoed time and again by Secretary Clinton and Administrator Shaw as well. But also it's a key part of our development efforts as a whole. And just last week at the UN General Assembly meetings in New York, the President highlighted the enormous progress that's been made against the Millennium Development Goals, but he also talked about how there's still a lot more work to be done. And if we are to meet these ambitious objectives that we as a global community have set, we need historic leaps in human development. And he said that these efforts can't fall exclusively on the shoulders of governments. The needs are too vast, the challenges are too great for any one sector to be able to take and address alone. So we ultimately won't be successful unless the private sector and diverse elements of the civil society organization can also contribute to this global effort. And this philosophy, this approach, is really an essential underpinning of GHI. And GHI is about creating real change in how we do business in implementing our global health programs. And one of GHI's core principles is to strengthen and leverage global health partnerships and private sector engagement. And so through this, we're all actively seeking ways that we can harness innovation, harness efficiency and networks and global reach, and the expertise of the private sector to be able to achieve these goals. And that's whether or not we're seeking to help to seek and deliver basic services, whether we're generating employment, or even fostering innovation. These are fundamental core element of the GHI. So luckily for USAID, partnering is not new to the agency. And there's a depth of history and experience in this area, and AID has pioneered many of the approaches for engaging with the private sector, and we've done this through global projects, through bilateral projects, and we've developed an array of private sector initiatives. And I'd like to highlight a couple different models. One is collaborative funding. 2 is leveraging technology and innovation. I'm going to give you some examples in each of these areas. 3 is leveraging expertise, and 4 is leveraging delivery and distribution channels. So first, collaborative funding. I'm not going to talk a lot about it. I think we all know some good examples under this area, Gavi and GAIN in particular being very important ones in maternal child health area. The second, leveraging technology and innovation. There's a couple different ways to think about this as we try to break these down into various models. One is leveraging product development to improve the tools that we have tomorrow. And that's, you can think about the product development partnerships that really have grown up over the last decade and have been building the pipeline of innovations today that we will be able to use somewhere down the road to achieve our long-term public health goals. This is IAVI, PATH's Malaria Vaccine Initiative, and others. And one that I'd like to highlight today, which is one of the truly exciting advancements most recently, has been our partnership with CAPRISA. CAPRISA being the Center for AIDS Program of Research in South Africa. And it was just this summer, the last month, where we announced the first ever proof of concept that a microbicide for women can significantly reduce a woman's risk of HIV infection. This was groundbreaking evidence that this innovation could potentially do what I think the field has been hoping it would do for a long time, and I think it shows great promise for the field as a whole. And I just want to point out that this was a trial where 90% of this trial was actually funded by AID. We conducted CAPRISA, it was conducted, by CAPRISA in South Africa, and it had the assistance of 2 NGO partners, Family Health International and also Conrad. So we expect to see and hope to see some very exciting efforts underway in the future, but that is a great example of AID's role in trying to leverage product development and bring new tools to the table. There's also leveraging innovation to be able to improve the availability, the quality, and the utilization of health services today. And I want to highlight a couple examples, and we have so many great examples, so it was really hard to pick. But one that I think is really intriguing is a partnership called Helping Babies Breathe. And this is a partnership focusing on reducing newborn mortality due to asphyxia. And this is a key cause of death for newborns. And what's really intriguing about this partnership is it's a partnership with five different players who have formed an alliance, and they each bring different sort of key areas of expertise and resources to the table. So Laerdal is a Norwegian company, and they're actually making resuscitation devices, and they're making these available to on a not-for-profit basis to the partnership. There's also the American Academy of Pediatrics, which has developed the evidence-based resuscitation curriculum to be able to improve skills among health providers. And this curriculum is actually provided to all members of the partnership on a royalty-free basis. There's NICHD at NIH that's evaluating the impact of this alliance, and they're a really important partner and an exciting part of this partnership. Save the Children is bringing technical expertise, and USAID is also bringing technical expertise and helping to fund the implementing partners. So it's hoped that this alliance will actually be able to increase coverage of newborn resuscitation, increase access to and availability of high quality, affordable resuscitation devices, and also improve the competencies of birth attendants. So this was just launched in June, and I think what they're seeing is really exciting is it's taking off, and it's almost organically growing and spreading at a pace that I don't think anybody had quite anticipated and expected. So it will be a great one to watch. The second area that's really important in this category is really one of the truly transformative fields in global health now that has the potential to leapfrog development in new ways, and that's the innovative use of information and communication technology. And this is such as mobile phones and broadband internet. And there's a growing number of partnerships that are capitalizing on these technologies and figuring out how to use these technologies to increase health benefits. And we're seeing a lot of promising ideas out there. There's a lot more that needs to be done. Most of these have not yet been taken to scale, so we have a lot of learning to do. We need to be able to do more to evaluate the existing efforts. We need to get a better idea of what works and scale those up, and we also need to develop new applications for these technologies. And one of the areas where we're be investing additional resources in the future is actually a program. It's building off of the U.S. government's Text for Baby program, and we're calling it Mobiles for Health. And we're looking to scale this up. And basically, it's a mobile phone-based health information service for pregnant women and new moms. And so it has some exciting potential. It's taking a concept that had been developed and fine-tuned here, and then thinking about how to make it applicable in developing countries which have some different and unique requirements and needs. The third is leveraging expertise, and this is sort of an important category where I think we need to continue to think about how we can do this better. The private industry has a great deal of expertise that if shared, it can help strengthen health organizations, it can strengthen health systems, and whether that's bringing in companies to help organizations build their capacity of their business functions, so their admin, their finance, their education and training of employees, or even strengthening supply chain management. There's a whole host of areas where the private sector across many different sectors has expertise that could be shared, and finding ways to best leverage that is really important. And we have some interesting examples in that area, which I'm happy to share. The fourth area is fourth model talk about is leveraging delivery channels, and there's a nice example in India. It's Hindustan Lever, and they're a group that they've actually developed it's a company. They've developed a franchise network of Shakti women, and they sell their products such as soap and toothpaste, and they sell them in rural villages. And what HUL does is they actually give these women microfinance loans to be able to start their retail businesses, and this is getting their products out into new markets, and it's creating these new distribution channels. And what AID is doing is coming in and actually working with HUL to be able to pilot the sale of health-related products such as ORS, and also training these women to be able to provide child health counseling. So we're piggybacking off of some other efforts and really bringing in some value add to that partnership. So I don't know how I'm doing on time. I think what I might do is, okay? You're good. Okay, so let me just give you a couple lessons learned, and these are just some thoughts in terms of successful partnerships, and I think there's a lot of lessons that we've gained over the years, so this is just a snapshot. But one is to really think about the unique rationale for each partner's participation. So it's very important to find partners that have their own unique value add, whether it's distribution networks, whether it's economies of scale, whether it's some niche expertise, whether it's the IP that they have. So that's a key piece, but it's also equally important to figure out what's in it for each partner. What is in their business, what's in their business interest to be able to engage, and it's really helpful to be able to articulate that. The second lesson is having a shared vision and shared end goals. And it's really important to be clear on the goals and the role that each organization plays. It's also very important to make sure not to sacrifice your own core requirements for the sake of another partner, and just to meet the other partner. So going into these partnerships, and this is true not just for AID, but I think for any of the partners, is really understanding what it is that's bringing you into the partnership, and not partnering just for partnering's sake, but partnering for particular health outcomes. The third is investment by all partners, and this is one that it's helpful for all the partners to have skin in the game, whether they're contributing in-kind resources, financial resources, they have something, a reason to be invested in the particular partnership. And then finally, potential for scale and longevity. And it's helpful to look for catalytic activities that have the potential to be self-sustaining, but also have the capability of being scaled up more broadly to other areas. So I'm going to stop there. We can make sure we have time for Q&A, but I do want to be able to point out that I have a number of colleagues who are going to be in the room today who are really the champions of these partnerships, many of the ones I've mentioned today, and they have a great deal of expertise, and we should feel free to engage them in the conversation, and they can give you more insights into some of these partnerships if you're interested. So thank you very much.